The knees have been getting worse for about 10 to 12 years, and it's just been a slow progression. It was February, I was at work, and I was just standing at a station, working on a computer, and I just felt something in my right knee, and I could feel it just swelling and the pain, and I went, something just went. Come to find out it was the patella tendon had just broken on that knee. And I went, that's it, I can't. I've dealt with this too long, I can't do it anymore. I had gone to see, many years ago, a different surgeon, and cold. If he spent 5 minutes, I'm giving him credit. Dr. Barrett, I swear we took 25, 30 minutes talking over everything.
Hey John, how are you?
I'm good, Dr. Barrett. How are you?
Good, thanks.
You could tell he really cared and he really wanted the best for me, so that's why I picked him. Got x-rays on both. I told him both were bad. He looked, he said, I can't do a partial. They're too far gone. They were actually the top and the bottom of my knees, the bones were actually grinding into each other. They were becoming one. He said, eventually you're not going to be able to bend them hardly.
He had terrible arthritis in both of his knees and big deformities where his knees bowed out substantially. It had affected his quality of life. It was affecting his ability to go to work and earn a living. He's a guy who is literally on his feet for 12 hours or more a day. He did that with knees that were quite arthritic, and he pushed through that, which is a huge testament to his own character. He got to the point where he could barely walk at the end of the night and really needed to have something done.
I have 2 jobs. I have 3 sisters that I kind of look after at times. And I said, I can't be down that long. So I really wanted to have them done at both times. At the same time, he went, no, that's not going to happen. He goes, but I think we can do it in 2 weeks. He said, but you're going to have to really work.
The best candidate for a knee replacement is someone who is very motivated to do well. I think knee replacements, more so than other operations, really require a lot of buy-in from the patient, which we had with him from the get-go. I mean, he wanted to get back to work and really push himself. He ended up proceeding and having both of his knees replaced at a separate timing, but he did them sequentially, a few weeks apart, and has done really well. I
thought it would probably go to, a hospital, but he said I was a candidate for that, so it was in and out the same day. I figured it'd be at least one night in the hospital just to make sure and everything, but I guess they've got it down to a science now. It was great. The people down there were just excellent. Everybody cares. I mean, they went over everything a million times just to make sure everything was done right. If you had any questions, they'd answer them. Just top notch all the way around. They give you the limo ride back to the house, then they're already waiting for you. They show you how to use the walker. I had the walker for 3 days, and then I was on the cane, and then about 7 to 8 days later, I didn't even need the cane. The worst part was the Sunday before the second operation, because I was feeling so good. It was like, I have to do this all over again. This one was such a breeze. I had no fear at all. Just went in, got it done, and went home that same day.
He's less than 3 months out from his knee replacements. He's already returned to full duty in both of his positions, and he's doing really well, and he's extremely happy. His mobility is literally night and day. When we first met him, he was having trouble walking. He walked with bowed legs.
Everything was hard. To go upstairs, every stair would have to be 2 foot. You'd have to put 1 foot down, then the other foot. Sometimes it was so bad, and honestly, you'd almost have to crawl up the stairs. Not to sound corny or anything, but it really has given me my life back. I'm 58, I feel like I'm in my mid-30s. And even everybody I work with go, will you slow down? Because I'm up and down ladders. And before it was just a drudgery to do it.
It is very gratifying and rewarding, as a surgeon to make that kind of an impact. John was set up to do well for this based on his own perseverance. And that determination makes the difference. Patients will do really well because they want to do really well.
If you're going through this, have it done. Don't wait. It's not worth it. Not worth the pain, not worth your life. I would recommend anyone to Dr. Barrett and University Orthopedics, because I don't think you can do better. Maybe somebody can do as well, but I don't think you can do better. That's all I can tell you.